Hey, this is Rick Kasalich, injury specialist from exercisesforinjuries.com. In today's video, I wanted to go through the best and the worst knee pain exercises. Now, when it comes to the best ones, let's start off with the stretching exercise as it relates to knee pain. So knee pain exercises and stretches. Now, the worst one ends up being heel to seat. So standing, heel to seat, bring in the heel as far as you can to your seat. A lot of times with people with knee pain, this ends up being a stretch that ends up aggravating things and making things worse. And that's because you end up having a lot of the kneecap being pressed up against the knee joint, and then also the knee joint ends up getting lots of pressure because of the heel being brought to the seat. So this ends up being a bad stretch for people with knee pain. Now, when it comes to a better stretch, when it relates to knee pain, it's doing a standing hip flexor stretch. So you're standing, front foot is flat and out front, slightly bent in the hip. Other leg is back. You're on the ball of the back foot. You're going to tighten up the abdominal area. You're bringing hips forward, and you're looking at getting a stretch in the front of the thigh, and then it'll oftentimes carry on into the hip. So this one doesn't specifically end up being a quad stretch, but you're hitting one of the quads in the thigh, and then you're also hitting the hip flexor. So it ends up being a good one without putting much stress on that knee joint. Now when it comes to sets, reps, time, and intensity, with that last one, sets end up being 1. Repetitions, I would do 2, like alternating sides. The intensity ends up being light. We're looking for a light stretch, but targeted stretch, and the time ends up being 20-second hold. Now moving on to another knee pain exercises and another stretch when it comes to knee pain. This ends up being knee bent at 90 stretch. So as I mentioned at the start, a lot of people can't bring the heel to the seat, but they're able to bring the knee to 90. And then what you're going to do is bring that knee back, focusing on your glutes and hamstring doing the work. You don't want to increase the curve in that low back. And what you're going to feel is more of a stretch in the quad, but also in the hip flexor as well. Now, since this ends up being a stretch, we're looking at the sets, reps, time, and intensity. Sets end up being 1, repetitions end up being 2, alternating back and forth. Intensity ends up being light. We're looking at a stretch, and the time ends up being a 20-second hold. So those end up being the worst and the best stretches when it relates to knee pain. Now, looking at, focusing on exercises, knee pain exercises that you can do at home, a couple exercises that aren't good for you to do that's going to aggravate and make your knee pain worse are the ones that I'm going to go through with Jenna. And the first one ends up being a deep squat. So squatting as far as you can and as deep as you can, and we end up having the same issue as we talked about at the start, which is it ends up putting a lot of stress on that kneecap and a lot of stress in that joint. So to start off with, if you have knee pain, we want to avoid a deep squat. Now the second one that we want to end up avoiding ends up being like a Hindu squat, which is, you're lifting your heels and then you're squatting down and then you're coming back up into standing. There you go. So that ends up being a Hindu squat. And the same thing, I'll get you to hold the bottom position for a second. How this ends up being worse is because you're on your toes, and now you put even more stress on that kneecap, which is pushing up against the front of the knee joint, and it will end up irritating things and making things worse, especially if your knee pain is associated with how well that kneecap moves and tracks in front of that knee joint. So those would be 2 that I would end up avoiding, or they'll end up making your knee pain worse. Now 3 that you want to do at home that will help with your knee pain, and the first one ends up being deadlifts. So we want to do something that really targets the hips and the glutes, because with knee pain, if we can strengthen up the glutes, that will end up helping with your knee pain. So the first ends up being a deadlift, and we'll just do a body weight deadlift. So your feet are a little further apart than hip width. Knees are soft. You're going to hinge through the hips. You go down like to there, and then coming back up. And then again, like feet are a little more than hip width apart. Knees are soft. You're going to bend a little bit at the hips, bend a little bit at the knees, mainly at the hips. Everything else here is in line. Hips, shoulders, and head are in a good straight line. And then you're going to come back into standing. And when you come back into standing, you're really focusing on the glutes doing the work and the hamstring doing the work. When it comes to sets, reps, time, and intensity for that one set, repetitions 10, time, smooth controlled movement with a good stop at the top position, and the intensity, we really want to target and focus in on the glutes doing the work, and then you'll feel it a little bit in the hamstring, but we don't want it to be all hamstrings. We want to work on the glutes, because if you have strong glutes, that'll end up helping with knee pain. Now the next one ends up being a great one to do. It's kind of in the best category. It ends up being single leg squatting. And if you're going to use the left leg, I'll get you to face that way. Yeah, okay. So single leg squatting, which leg do you want to do? Okay. Okay, so we're standing on one leg, foot's flat. You're going to bend in the knee, you're going to bend in the hip, good, and then coming back up. So standing on one foot, weights even through the whole foot, maybe in the midfoot or a little bit on the heel, bending in the hip, bending in the knee, bending the hip, bringing the upper body forward, and then coming back up. Now this one ends up being a great exercise because we're targeting the hip again. And oftentimes with people with knee pain, the issue ends up being weak hips, like we talked about weak glutes, but then also stability in the hip. Because when the hip's unstable, then the knee has to work harder to keep things under control in the lower body. So we want to go with a single leg squat so we can end up working on the stability of the hip, working on the glutes, but then also we're working on strengthening up that knee. And you can see with Jenna how she ends up doing it. She ends up having her hand on the wall, and that ends up eliminating balance so that we can end up focusing on doing the exercise correctly, the movement correctly, and hitting the right muscles correctly. When it comes to sets, reps, time, and intensity, sets end up being 1. Repetitions, go with 5 to 10 repetitions. Time ends up being a smooth controlled movement with a good stop at the bottom position, so 1 to 2 seconds. And the intensity, we really want to feel it in the hips, in the glutes, and a little bit in the muscles around the knee. And this ends up being more of a strengthening to exercise. Now another one that falls in the best category ends up being a single leg press. So you're going to sit, you're going to have a seat, you're going to take some sort of resistive tubing. We've got this, this loop tubing here, and you're going to have a seat. You're going to bring the knee towards you. You're going to create some resistance by pulling the tubing back, and then you're going to straighten the leg out, and then you're going to come back. So with this one, we're really targeting that knee, and we're getting a little bit of hip work, but we're unloaded. So we're not putting as much stress in that knee, and we're working on strengthening all the muscles around the knee. And we're able to kind of strengthen that knee through full range of motion, so the full movement that it ends up going through, which ends up being important. And a lot of people make that mistake and do not, and only strengthen a small part of that knee, and that ends up leading to their knee pain prolonging a lot longer. When it comes to sets, reps, time, and intensity, sets end up being 1. Repetitions, I would go with 5 to 10 repetitions. Time, smooth controlled movement with a good stop at the end position, 1 to 2 seconds. And the intensity, we really want to feel it in the muscles around the knee, and you might feel it a little bit in that hip area. So those end up being a couple of the worst and the best when it relates to knee pain exercises at home. Now I wanted to kind of talk about knee pain exercises as it relates to women, best and worst, and also for men, the best and worst, because knee pain ends up being different in men and women, and the focus and the exercises are different as well, especially when you look at things when it relates to the best and the worst. Now, starting off with women, two of the worst exercises, knee pain exercises, end up being a deep squat. So we already demonstrated this at the start. A lot of times with women, it ends up being that patella or kneecap that ends up being the issue, and pressing that kneecap up against the knee joint or affecting that movement or tracking of that kneecap makes things worse when it relates to knee pain. So we want to avoid deep squats. In time, we want to move towards doing deep squats because there's a lot of benefit from them. But right now, we want to minimize or eliminate them as they're going to make your knee pain worse. The second worst thing is, a lot of times if you end up looking and reading magazines and looking at stuff on the internet, a lot of times what they recommend for women is to do squats. And the big thing is, women oftentimes do squats incorrectly, and that ends up leading to more knee pain. So looking at common mistakes when they're going through the squat is they'll end up having more weight on the balls of the feet. They'll let their knees pass the toes. Other things that they will end up doing is that trunk will end up being too much forward, and then it'll end up getting you to stand up. One other thing is people end up trying to keep their upper body way too straight when they're doing the squat. Yeah, there it goes. And with that one, that leads to more the knees moving forward. So with the squat, it needs to be a combination movement with hips and knees. And I find it's like, hips go and then knees go. Hips and then knees. It's a really short gap between the two. It's not all knees, then hips. That doesn't put a lot of stress on the knees. We want the hips to go, and then quickly after, the knees start following when it comes to movement. So those are two kind of bad things to do, or worst exercises for knee pain, especially if you're a woman. Now let's get to the best ones. Looking specifically at two, the first one ends up being leg raises. So you can do this on the floor lying on your stomach, or we're just going to do it quickly here up against the wall. So your hands up against the wall, you're at a bit of an angle against the wall. You're going to bring one leg back as far as you can. Good. And then coming back down to the start and then going again. Yeah, other side. And you can alternate back and forth. Key things to remember, we're targeting the glutes. Mainly the glutes. We want the glutes to do the majority of the work. You're going to get some hamstring work. We want a little bit or minimal movement in that low back. And we want minimal to no movement when it comes to rotation or twisting. That pelvis, the hips. We don't want them to rotate. And really focus on bringing that leg straight back and that heel straight back as opposed to twisting. When it comes to sets, reps, time, and intensity, sets end up being 1. Repetitions, go with 5 to 10 repetition range on each leg. When it comes to time, smooth controlled movement with a good stop at the end, really contracting the glutes. And the intensity, we're really targeting the glutes, secondarily the hamstrings, and in this leg that you're stabilizing or standing with, you might end up feeling the muscles in the hip working, and that's perfectly fine because we're working on stability in that supporting hip, which is great. Now that ends up being knee pain exercises for women. Now let's talk about men and some of the worst exercises or mistakes that they end up making and what they should end up focusing in on when it comes to best exercises. So the first, and it's not really an exercise, a lot of times an issue that I find with men when it relates to knee pain is they end up having poor flexibility. Now when you end up having an injury, things tighten up all around that injury, above and below as well, so your flexibility decreases even more. So men need to address that flexibility when it comes to an injury perspective, but also from like a whole body perspective. So it's not necessarily a worst exercise, but it's a common problem that men have that they need to address. Now the second thing is looking at the program design. So men end up focusing a little bit more too much on the upper body, and they need to focus a little bit more on the lower body, and that'll end up helping with knee pain recovery. And the area to focus in on is a lot of hip work, as I talked about earlier in this video, strong glutes and hamstrings will end up helping with a decrease in knee pain. Now let's go through the exercise that you should focus in on. The best exercises for men, these can be done at home. First ends up being a standing hip flexor stretch. And we show this one, you're stepping forward, flat on the foot, bending the ankle, bending the knee, back leg is behind you on the ball of the foot, leg straight, you know, tighten up the abdominal area, tighten up the glutes, bring the hips forward, and we are targeting the quad, and also the hip flexor. Sets, reps, time, and intensity. 1 set, repetitions, 2 on each side, alternating back and forth. Intensity, we really want to feel it in that quad hip area, and time, you're holding it for 20 seconds. Now moving on to the next one, we kind of covered this one as well, knee bent to 90, quick stretch. So against the wall, standing, bending at that knee to 90, and then bringing that leg back using the glutes and hamstrings, targeting that quad and the hip. And so this ends up addressing the flexibility, not putting too much stress on the knee, but targeting the flexibility in that knee and hip area. And sets, reps, time, and intensity. Sets 1, repetitions 2, time 20 seconds, and intensity ends up being a good stretch in the quad, the thigh, hip area. Now last one is bridging. So working on those glutes and the hamstrings, and the bridge that I'm going to talk about is I'm going to get you to flip over on your back. And what you're going to do, is you're going to tighten up the abdominal area, press through the heels, lift the seat up, and there we go. So we're targeting the hamstrings and the glutes, and then you're going to come back down. And maybe I'll get you to move this way. Good. Lying on your back, hands are to the side, tighten up that abdominal area, push through the heels, lift up, working those hamstrings and glutes, and then coming back down. So with this one, we're really targeting the glutes. We want them good and strong, and they will help when it comes to decreasing your knee pain. Sets, reps, time, and intensity. Sets end up being 1, repetitions between that 5 to 10 range. Intensity ends up being really targeting the glutes and the hamstrings, and then also working, and also when it comes to time, smooth controlled movement with a good stop at the top. Now there you go, that ends up being the best and worst knee pain exercises. Give those a go. Now, if you're still suffering from knee pain and want to know some of my other best tips and tricks when it relates to overcoming knee pain, then I recommend you click right here. I have a brand new free report called 5 Tricks That Fight Knee Pain and Tightness. Click right here, let me know where to send that report, and I'll send you that report right away. Now, if you're watching this on a mobile device, tablet, smartphone, head down below in the description, click the first link, which will end up being exercisesforinjuries.com/knees. Let me know where to send that report, and I'll send you that report right away. Now, if you got benefit from this video, like this video. If you have a question or comment for me, leave it down below in the comment section. And lastly, hit subscribe to get future pain relieving videos.